Hey guys, welcome back to the career advancement class. And we are on day 2 of career advancement, specifically for RBTs who hold a bachelor's degree. And this one, we're going to focus on the career paths that your degree can take you so that you don't have to be stuck in being an RBT for another 6 years and think that the only way for you to advance is to become a BCBA. So your degree type matters, okay? So let's be clear now. Not every bachelor's degree is profitable for advancing in ABA because they are missing vital ABA behavioral strategies, terminology, and overall knowledge for the student to know when pursuing a career in this field. However, there are a few I found so far that the BACB and companies see profitable for you to work in this field. So, one is psychology, two is child slash special education, three is social work, four is rehabilitation and recreational therapy, five is human services slash healthcare administration, and six is nursing and health sciences. And I also want to be clear on this. I am not a career counselor. I am a former RBT that is passionate to help other RBTs advance in their career. So, number one, becoming a social worker. And I have to also be clear on this. I forgot to say this as well, that every career path that I will be advising you, I have not been any one of them. I have done in research as much as I can to better educate you guys on these career paths, and anything that you see that stands out to you, then you can do your own intensive research on how to pursue this next career step, okay? I just had to make that clear. So number 1, becoming a social worker. So a preferred degree is in social work, psychology, nursing, or healthcare administration. Two is pay. Earnings range from 38,500 to 54,500 per year, with some individuals earning as high as 70,000 or as low as 29. However, pay is dependent on experience, certifications, and location. Three is skills needed. Now, for you to look at the Indeed article, unfortunately, since I am recording on Canva, I won't be able to click it. However, it is available on the resource sheet that I have put on the Stand Store community, and is under the resource tab. Every link is going to be on that sheet, okay? Now, how does your RBT experience prepare you for this career? As an RBT, you already have experience in documentation, interpersonal communication, crisis intervention, and more. However, to take the next step in your career, you may need to build additional skills such as managing multiple cases, networking with other professionals to connect clients with the support need, and gaining a solid understanding of insurance systems. On the next page, we'll explore how you can build that experience. So these are all entry level jobs. And to gain the skills you need, it's important to start with an entry level job position that exposes you to the clinical side of ABA or healthcare period. I've listed a few roles that you can consider to get started, but please remember that many of these positions pay less than an RBT role. But keep in mind why you are doing this. It's not for the pay, it's for the experience. I will always say this. There are times in life when you realize having more money can cause more problems than having little. Impact on people's lives matter more than the money you make. Passion for helping others will fulfill you more than the money in your bank account. So this is an opportunity to better yourself, to better help the ones you are serving. So, vocational coach, this is someone that helps a client find a job, and the pay is between $15 to $33. Direct support professional, They usually tend to older clients. Some of them have multiple cases, some may have one. A vocational coach as well can have multiple cases or just one. But you won't really know until you get into the job position. And a caseworker, they also have multiple cases and the pay is between 15 and 33. And intake specialists, they see multiple patients a day. Usually the patient comes to them. This is more for the administrative side, just taking patient information and learning the system and stuff like that. Okay. Now, mid-level ABA careers. If you have some type of indirect clinical skills, then you can do these mid-level positions in your state or relocate if needed for higher pay. So healthcare administrator is 25 to $35 an hour. BCABA is 25 to 65. Social worker 25 to 30. And a new one that someone told me is a qualified individual developmental professional, 25 to $36, and the link is also in the resource sheet. Okay, so different job titles they are giving for these careers. So BCABA, we have behavior specialist, behavior strategist, behavior lead, behavior support specialist, and QUIDP, which is the qualified individual developmental professional. Okay, number two is the caseworker and vocational coach. They have transition coach, program director, social director, youth coach slash counselor, support living coach, case slash program coordinator, or job coach. Now, when it comes to youth coach slash counselor, I've seen that mostly at the YMCA, and support living coach, I've seen that job title in Florida only. You can become a support living coach or provider. You can work under an agency or you can work independently. And they have free courses. You register at www.apdcares.com and you can become a social living coach or provider. Some do not require a degree, and you can, if you have no degree, you must have, I believe, it's 4 years of direct experience. But in this case, if you have a degree, I believe it's about 2 to 3 years of direct experience working with individuals who has disabilities. Okay. And I will actually put the link in the resource sheet as well because I did not put it there, but I'll put it there for you guys. And lastly, number three is healthcare administrative jobs. This is patient coordinator, intake specialist, or client scheduler that I found so far. So these are the titles that you can search on Indeed or job sites. Okay. And I want to be clear for the BCABA, if they don't say specifically BCABA or require certification, just know that these positions will pay a lot less than a BCABA. I just want to be clear on that. Um, I'm not exactly sure why, but I believe like many companies are saying, some insurances are not reimbursing for BCABAs. That is not the truth for this is not nationally known because Florida and many other states still hire for BCABAs. However, if they're not hiring for that specific job title or requiring that certification, then there's other insurance codes that they are using to pay you as a mid-level behavior analyst, but the reimbursement is low. Now, the best job role that can give you supervision, case management, and clinical experience is becoming a BCABA. Why? Because you gain supervision and clinical experience while earning a higher amount of money compared to the other jobs. As an RBT, you do not gain the skills that a BCABA gains while being in the field. You do not have access to update assessment, supervise RBTs, and help parents find resources if needed for their child. Now, I want to be clear. Some of you can do send additional resources to the parents, but when an employer is looking at your job and the description of what an RBT does and what you did, they don't automatically assume that you are providing supervision and resources to the parents. All they assume is you only work with the client. That's it. That's the only services you provide. So during the interview, if you have done any extra work as far as providing resources to the parents, or you have trained RBTs when it comes to onboarding training, that's the ethical way, onboarding training, then or administrative work as well, you can say that because that's also ethical. Then you can say that during the interview and you can put that on your resume. Okay. And I'm gonna be clear as well. You can train RBTs, but I want to be clear when I say train. When it comes to the supervision, I know there's some RBTs, and these are not student analysts, regular RBTs, that there's other RBTs who shadow them while they're with their client. That's fine. That's not ongoing supervision because the RBT is just looking at you and the client and see how you're interacting, and they may ask a few questions here and there. That's fine. But if you see yourself going there every week, or once a week, or once a month, I should say, when the BCBA is not present, and then they're telling you, hey, can you just help out this RBT while the BCBA comes back, in next week or whatever it is, that's when there's an issue. That's when there's an issue. So just be careful. Always be mindful of what you're doing. Don't let these employers make you do more than what you're supposed to do. If you're not a qualified professional, don't do a qualified professional job. You can say no, because what they're going to tell you, they're going to fire you. And then if they fire you because you want to protect your ethical standard of being an RBT and protect your certification, leave that company and report them to the BACB. That's what I'm saying. Don't let anybody bully you to do more than you have to because they want to cut corners or the BCBA is not available. Now, let me keep moving. We're going to discuss this topic, by the way, on Wednesday. We're going to discuss this topic on Wednesday. So let's keep going. Number two, being a BCABA, it builds your organizational skills by managing more than two cases while doing indirect work. An average RBT caseload is typically two clients at most. However, when you work as a social worker or vocational coach, you often manage more than two clients at a time. This position can help you develop the skills needed to manage your time effectively while still meeting the needs of each client. And three, it opened doors of opportunities. You are a qualified mid-level behavior analyst. That's what it says on your certification. Behavior analyst, not a technician. That role carries more weight in the workplace and allows you to do more for the community while earning a livable and stable wage. So the difference of an RBT and BCABA task, I put the link there for you guys, but also I attached it to the resource sheet where you can see exactly what the BCABA says that our BCABA's tasks are and what an RBT task are. And even if it's studies, like, because I think the BCABA task list is based on what they have to study for the exam. Guess what? Whatever you're studying, that's what you're doing in real time. Okay, so that's what you're supposed to do as an RBT and as a BCABA. So just refer to what I said, page 3 for the BCABA task. And this is the difference how an RBT cannot do the same thing as a BCABA. And for the RBT task list, refer to letter C through F. Okay. Now, behavior support / intervention specialist. This is another job title that they give you as a mid-level behavior analyst. I have seen these titles used interchangeably as an RBT role or BCABA role, but mostly RBT, mostly RBT. But the difference is the key is that they require a bachelor's degree, and your RBT certification may or may not be required. And again, many of these companies, when they hire a behavior specialist or intervention specialist and they require a bachelor's degree, is because either that state does not fund the BCABA role, or the insurance they use does not fund the BCABA role. And they can use other insurance codes depending on the client's program and stuff like that for you to work as a behavior support specialist or behavior intervention specialist. But just be mindful, right? But that's really what it is, especially when you work with adults and teens. You will see that ABA is how can I say? I guess used differently than working with children. Sometimes you don't stay with the adults for 6 hours. You know, you got different clients, and the hours a month are shorter than compared to a child. And I'm speaking from experience working with adults as a behavior specialist. The hours were a lot shorter a month. So I had like 15 cases, so I was able to do hybrid remote, 80% hands-on, 20% hybrid. I was teaching the parents, the caregivers, the staff on the behavioral strategies. I was actually teaching them, which is what you don't do as an RBT. You don't teach other staff that, as far as if you work at a different setting. This is what a mid-level behavior analyst does, which is again a behavior support specialist or a BCABA. Okay, let's move on. Behavior strategist. The YMCA uses this title. It does not require a BCABA certification. I don't believe it requires an RBT certification, but it does require you to have some type of experience in supervision and organizational skills, meaning like you're able to manage multiple cases, not just two, multiple cases. And supervision means that you're supervising the staff and sometimes the people or the clients or the program as well itself. Okay, so that's what I'm saying. It's completely different than what you do in day in the life as an RBT. And behavior specialist, make sure it doesn't say master's degree, because I've seen some companies they use behavior specialist, but they're requiring the BCBA certification, master's degree required, and some don't. Okay, I know I'm saying a lot, guys, but I gotta make sure. I gotta make sure. So, examples of jobs listed is in the resource sheet. Let's keep moving. Please note that a lead RBT is not the same as a BCABA. It's an unofficial role that some companies introduced about 2 years ago and is still not widely recognized. You rarely find lead RBT positions listed on job sites like Indeed because it's typically an internal promotion based on a clinic's need. Lead RBTs aren't paid as BCABAs because RBTs is what they're officially called according to the BACB, are not um are limited in the services they get reimbursed for compared to a BCABA. Any pay increase, such as an extra $5 an hour, likely comes from the company's budget, or some insurances will pay an RBT a little bit more if they hold a bachelor's degree. Um, I've heard that from billing specialists that I've spoke to. So earning your BCABA opens the door to more stable and higher level roles beyond your RBT experience alone can offer. While some RBTs may have gained clinical exposure as an RBT than others, that's not the same experience across the field. And guess what, y'all? Last week I had a BCBA on my TikTok live event, and she stated that she was an RBT pursuing the BCBA certification. She got the certification, but she did not get that high paying job offer when she first started. She got below below 80K. I think she said it was 70,000. She received a 60K offer and a 70K offer. While that may be good, right? But at the same time, many of you are expecting to make 80, 90, 100K your first time. That's not going to happen unless you have some type of mid-level behavior analyst um, experience, and you got to have a good amount, not just a few months, a year or two or three, and then you can pursue your BCBA certification, and you will have a higher job offer because you were doing a similar role as a BCBA and you got experience. I'm telling you guys, I'm not against you becoming a BCBA. I'm just saying use your degree as much as you can and take advantage of it. You know what I mean? Don't let people say that, oh, you might as well just get your BCBA. You might as well just get your BC. Like, it's so easy to just spend thousands of dollars in a master's program. People are already struggling to even get unrestricted hours. They gotta outsource that to get unrestricted hours. Like, it's not easy. And nothing in life is easy, but at the same time, what if that's not what you want to do right now? What if you don't know if you want to be a BCBA? And many of you only work with children. You have no idea that a BCBA, you don't have to just stay and work with kids. You can do clinical work, but you got no clinical experience. So even if you can be a clinical manager, you got no experience whatsoever. You know what I'm saying? So you will be stuck still doing what the same traditional route of ABA that you have seen, because you don't know what else you can do with your certification. This is why there's many BCBAs who quit after 2 years, and they're doing other things with their certification that is not the traditional route of ABA, because they didn't know they could do more. So this is why I'm telling you, as an RBT having a bachelor's degree, you can do more and take advantage of your degree, get the experience from these mid-level behavior analyst job roles, and just do it. Don't listen to people that want to tell you rack up on some debt and they're not going to help you pay for it. Now let's end with this one, right? Additionally, I think I already stated that earlier. Many RBTs who become BCBAs without gaining experience as a mid-level behavior analyst did not receive the pay they expected. This is often due to the lack of hands-on experience in supervision and assessment work. As outlined in the BCABA task list, a mid-level behavior analyst is responsible for significantly more than an RBT who is limited to ethical entry level tasks. Okay. So, y'all, we have ended the 2 day career advancement webinar. If you want to join my Facebook, not if, no, you should join my Facebook group called RBT Tipster Community. I post many mid level behavior analyst jobs time to time in different states, whatever I find. So, you guys can just be more like, okay, there are things out there. I'm not just talking because I want to prove a point. I'm telling you, there are positions out there. Follow me on TikTok if you haven't at RBT Tipster. And please let me know in the comments anything that you would like me to speak about, any positive, constructive feedback regarding this webinar. This is the first webinar that I've made public. And I would just love any constructive feedback, anything. Let me know in the comments, okay? Thank you all for listening, and I'll see you at the live tonight for Q&A. And listen, come on Wednesday. Come on this Wednesday, I believe August 6th. We are going to talk about the lead RBT position and the BCABA position. I will have those task lists posted as my background so we can read it together and talk about it. Okay? Love y'all. God bless y'all. And I will see you soon.